World Antimicrobial Resistance Awareness Week. From the 18th to 24th of November, it is celebrated or observed as the World Antimicrobial Resistance Awareness Week. Antimicrobial resistance occurs when bacteria, virus, fungi, and parasites change over time and no longer respond to medicines, making infections harder to detect and increasing the risk of disease spread, severe illness, and death. As a result of drug resistance, antibiotics and other antimicrobial medicines become ineffective and infections become increasingly difficult or impossible to treat. A global action plan to tackle the growing problems of resistance to antibiotics and other antimicrobial medicines was endorsed at the 68th World Health Assembly in May 2015. One of the key objectives of the plan is to improve awareness and understanding of antimicrobial resistance through effective communication, education, and training. World Antimicrobial Resistance Awareness Week is a global campaign that is celebrated annually to improve awareness and understanding of antimicrobial resistance and encourage best practices among the public, One Health stakeholders, and policymakers who all play a critical role in reducing the further emergence and spread of antimicrobial resistance. So, fighting antimicrobial resistance takes all of us. So, that is the theme. So here the One Health approach to fight antimicrobial resistance, which recognizes the health of people, is closely connected to the health of animals, plants, and their shared environment. Working together, we must improve the global prescribing and use of antibiotic and antifungal drugs and invest in global infection prevention actions across the health of humans, animals, plants, and the environment. For example, soil and water. So each day, a different theme is being focused. So the different kinds of themes are: it is fighting antimicrobial resistance takes us all. That is the theme for November 18th. On November 19th, the global threat of antimicrobial resistance. On November 20, human health and antimicrobial resistance. On November 21, animal health and antimicrobial resistance. On November 22, antimicrobial resistance in agriculture and the environment. On November 23, One Health approach to antimicrobial resistance. And November 24, continuing the fight against antimicrobial resistance. So these are the themes under which each of these days are celebrated. On November 18, it is fighting antimicrobial resistance takes all of us. So everyone has a role in fighting antimicrobial resistance. Working together through a One Health approach, we must improve the global prescribing and use of antibiotics and antifungal drugs and invest in global infection prevention actions across human health, animal health, plant health, and the environment. On November 19, the theme is the global threat of antimicrobial resistance. Antimicrobial resistance is a global challenge that has been identified in all regions of the world and can spread rapidly from one part of the world to another. The amount of resistance, number of infections, capacity and resources for infection prevention and control, and healthcare quality vary worldwide. Access to clean water and sanitation and vaccination also differ around the world. On November 20, the theme is human health and antimicrobial resistance. Antibiotics and antifungal drugs are valuable tools for treating infections, but their use for people, animals, or plants can contribute to antimicrobial resistance. Anytime antibiotics or antifungals are used, they can cause side effects and contribute to the development of antimicrobial resistance. One of the most urgent threats to the public's health. Many medical advances are dependent on the ability to fight infections using antibiotics, including joint replacements, organ transplants, cancer therapy, and the treatment of chronic diseases like diabetes, asthma, and rheumatoid arthritis. If antibiotics or antifungals lose their effectiveness, then we lose the ability to treat infections and control these public health threats. Number 21. So, animal health and antimicrobial resistance. Pet owners practice healthy habits when caring for your animals, like washing your hands after touching or feeding your pet. Try to keep your animals and pets healthy by keeping up with your pets' vaccines, deworming, and flea and tick control. When your pet is sick, be sure to talk to your veterinarian about antimicrobial resistance and using antibiotics and antifungals only when needed to prevent risk to your pets. Veterinarians can work with animal owners and producers to slow the spread of antimicrobial resistance by ensuring appropriate prescribing and use of antibiotics and antifungals and implementing infection prevention and control strategies while providing high quality medical care for animal patients. Animals carry germs in their gut, including antimicrobial resistant germs. These germs can spread between animals and in their environment. Farms, in animal markets during transport and processing, and then to people. It is important to protect the health of animals and the people who work with them, the community, and our food supply. On November 22, antimicrobial resistance in agriculture and the environment. Human activity can contaminate the environment, for example, water and soil, with antibiotics and antifungals, which can speed up the development and spread of antimicrobial resistance. Antibiotics and antifungals are sometimes applied as pesticides to manage plant and crop diseases. However, using antibiotics and fungicides in agriculture can contribute to the development and spread of antimicrobial resistance in the environment in humans and in animals. On November 23, One Health approach to antimicrobial resistance. So, antimicrobial resistance is a one health problem that can affect the health of people, animals, and the environment. One Health is an approach that recognizes the health of people is closely connected to the health of animals and our shared environment. If we all work to improve antibiotic and antifungal prescribing and use and take preventive actions to stop infections from happening in the first place, our collective actions can reduce the spread of antimicrobial resistance globally. Number 24, continuing the fight against antimicrobial resistance. So, organizations like the CDC is a leader in the fight against antimicrobial resistance and invest in national and global infrastructure to detect, respond, contain, and prevent antimicrobial resistant infections across healthcare settings, communities, food supply, and the environment to protect people and save lives. So, fighting antimicrobial resistance takes all of us, and everyone can play a role.